Paul Abramson. I'm a practicing medical doctor and an engineer in San Francisco, and this talk really came out of the Quantified Self Conference, where we had a nice discussion with Nancy and with Fred Trotter and others about the interface between quantified self-trackers and doctors in the medical community. So I'd like to talk about the perceived needs on the behalf of the self-tracker. Many of you may need things that only doctors can order, in California anyway, like lab tests, like implantable glucose monitors, like medications. You may need professional guidance and interpretation. You may have health problems that are going on. And then doctors really have a lot of problems in their medical practices because they don't have time, they can't get feedback from their patients, they can't get people to change their behavior, and they really need some true healthcare reform, which I really think quantified self techniques have the potential to produce. So there's this real disconnect between what's out there and what these two sets of people need. So there are various types of self-trackers, and I've blogged about this a little bit. And it's helpful to differentiate the self-trackers into different groups to figure out what their needs are and how you can interface with them from the medical perspective. So the hardcore quanters, some of you are among them, I've talked to you. You want the implantable glucose monitor, you want all sorts of tests, but you don't really want to go, you don't feel like you need a doctor for that, but you do need a doctor for that. So you just want to come, and that my role is to check, make sure you're sane, that your project is safe, that you're more or less okay, and then just to say yes, I'll facilitate that for you. Whereas quant-ready patients, where they really want to engage with a medical professional to design proper experiments, to identify the right tools, figure out which problems and questions to answer. So, and then there's the other patients, which is a vast majority of my patients through my career, not so much at the present, who really are in the passive, just fix me paradigm. They're really not thinking proactively. And my job is just to motivate them to, over time, get more involved and more proactive and maybe adopt some self-tracking tools. And then there's the misguided quanters. One in particular, he was a man who came to me, he was 94 pounds. He was obsessed with food allergies and self-tracking around food allergies. And he was juicing, and he was bright orange. And I measured carotenoid levels to prove to him that he was hurting himself. He had carotenoid levels like 10 times the upper limit of normal from his juicing. So identifying those patients and getting them the proper help. And so I have a few examples that I'm going to go through. I have a 92-year-old patient who's sort of pre-quant. She can't sleep. She's miserable. Hard to know what's going on. She's homebound. So I could give her sleeping pills, and that would stop the complaints. And it would make an addict out of this poor 92-year-old woman. I could try to get her a sleep study in a lab. Forget about it. She doesn't leave home. I'd get a very rich data set for one night. It wouldn't really tell me what's going on at home. I could put a bedside audio recorder and see if she snores. Cheap, effective for that, but not very useful for her. We could do accelerometry on her wrist to see how many times she woke up during the night. We could do, sort of bare bones EEG measurements with the Zeo, and that's actually what I chose to do in this patient. And what I got was a week of data from her, and we could find out that she's actually sleeping, and she is waking up a fair amount during the night. And we talked about that, why, and urination, and different reasons why she was waking up, and why her subjective experience was different from reality. And it was a really good discussion. She actually got better immediately just from seeing that she was actually sleeping. So I have a lot of patients with complex symptoms that nobody can figure out. They've seen 6 or 8 medical specialists. They've had every possible test, and they're starting to get told, go see a psychiatrist. And so most of these patients are amenable to self-tracking. Mostly right now the tools are Microsoft Word and a spreadsheet. And they are tracking manually with diaries, with various very bare bones tools, and that's really all that's out there right now that's practical. You can use different apps, but they're all very disconnected, and even the ways to aggregate them are pretty bare bones right now. So it's really early days, but the reason I'm so interested in this is I think in the next 1 to 2 years, this is going to radically change, and it's going to become ubiquitous and easy for people, even like my 92-year-old, to get rich data sets. And there are a lot of challenges that I've identified in trying to work with people over time. The tools are just not there. The standard data formats, the APIs, the platforms that give the patient control of their own data and aggregate it and visualize it just are in development. So medical practice challenges, you need different models of practice that are more flexible, where doctors can apply time and the appropriate tools to really help people with these kind of experiments. We need a common vocabulary. Doctors just have no idea when patients come to them with spreadsheets what to do with that or what the patient really wants from them. So how can we help doctors best engage with the self-trackers? How can we help self-trackers find a doctor who's open to this approach? And what other kinds of people can really help this process? Maybe something on the order of a quant coach who can, at a lower cost than a physician, help the patient to be the interface between the technology, the patient, and the medical system. So we need a community of quant-friendly doctors. I'm working on that. We need communities of self-trackers. We've got this. There's the e-patient movement. And we need a whole set of rich educational materials to help patients and doctors learn about self-tracking and communicate with each other. So I'm blogging a little bit about this at quantdoctor.com. I set that up right after the conference in May. And I'm easy to find if you want to talk more. Thank you.